I'm scheduled at 2004 today with exams and Velscopes in there. I just converted for premolar sealants on Brenda, so I'm probably at 2104. Chi Zhang is my next patient. Dr. Joe did an upper denture for her. If she needs an adjustment, I'll come check with you, but besides that, no treatment needed. Kristen and Madison Mila are mom and daughter. Madison just started Invisalign, and Kristen wants it once she's done, which will be probably in the 11 months or so. Christy Salber is my patient right before lunch. She's gonna bring her 1-year-old for like a knee exam, see what we can see. She's having sensitivity on the upper left from a root canal that was done elsewhere. Claire Baker's in. He's a past Lanape patient, so see how he's doing there. And then he does need 2 fills and a crown for decay underneath the crown. He says it's financial, but I'll dig in and see what's going on there because his wife accepts treatment. And then Angie at the end of the day needs some preventative treatment, low priority, so we'll see how that's going. That's it for me today. I'm at about 85% fluoride for the month so far.
Today I am scheduled a little bit of 1,000. My first patient, Catherine Mattel, currently has 3 crowns treatment planned, with one of them being a root canal, number 9. I have a Lanape polish at 11. Then at 11:40, a comp exam, Der Vang. Doctor, you saw her last week for a limited exam. This is her very first dental cleaning ever. I know we extracted number 31, so we'll do a post-op, making sure that's doing well. 2 o'clock comp exam, Donnie Nunnery. He last saw Dr. Olga for a limited exam. He was having pain on the lower left. X-rays and visual exams showed no significant findings. Doctor ended up adjusting the bite on number 19. 3:40, kind of reactivation patient, Mark Zernjabel. His daughter, son, is also with Bridget today. I know they request you for their exams. And 40% fluoride. I checked. My patients today do not have any adult ortho coverage.
Today I'm scheduled at 8:78. My first patient, Nicholas, is 3-month perio maintenance following scaling root planing. Alyssa Brubaker has sealants in her schedule or in her treatment plan remaining. And then my 1 o'clock patient is a new patient. She's coming from First Impressions. Her last dental visit was a year ago. She's 11 and her parents are interested in braces. And I am scheduled at 60% fluoride for the month, and my only patient, Alyssa Brubaker's got 50% coverage for ortho at no age limit.
Okay.
For me today, my first patient at 9 o'clock, Brittany, she is scheduled or does need full mouth sealants, so we will look into that and hopefully get her started on some of those today. My 9 o'clock or 10 o'clock patient, Megan, she's no treatment in there, just needs her bite wings updated today. Then my 11 o'clock, I do have in today for replanning scaling. She's in today. Her husband is in Dr. Tim's rock column today. And then my 12 o'clock does have adults ortho coverage that she can get started with. I will check to see if she's a candidate, and then I'll take photos and get her started with that and talk to her about that. And then my 2 o'clock, Sally, her husband is with Jenny today. She does have a crown in her treatment plan. I will talk to her about that and see if I can update a PA and a photo for that, and discuss with her the crown number 31. And then my 3 o'clock, same dad is with Bethany, and then he does have the tongue tie that he wanted to talk about, so probably referring that out. And then he also does have ortho coverage, so probably Invisalign. I believe he was about 10 years old, so we'll see when you wanted to get that started with him. And they request seeing you, and then he does need sealants. So hopefully get some of those done today. And then my 4 o'clock, he does have a very large treatment plan, crowns throughout the mouth. He did have previous Lanape. Eventually it will need to be retreated because his home care has been very poor, and he does have he just had a baby and everything in his personal life, so that's kind of his financially for getting any treatment started with crowns. That's his financial barrier, he keeps saying. And he is unconfirmed for the girls up front, but he usually does show up. He just never confirms because he works all through the day, so he usually never calls back. I'm at $12.59 for today, and that is including exams, and I'm at 54% fluoride for the month. Okay. Today I'm at 8:20, that's without exams. My first patient, Chris Haybeck, needs crown on 19, Dr. Tim usually see him. And then I have a new patient at 11:30, Stephanie. She has a toothache on the left side, so we'll hopefully get that taken care of today. I have a 10:20 opening, so if anybody needs anything, there's opportunity there. My 2 o'clock Donna needs lower right crowns. And then I have Angela and Kimberly, they're mother and daughter at the end of the day. Kimberly does have ortho coverage, and I think she's 15, so we'll look at that today. We did her sealants already, so her treatment's complete. And I'm at 80% for fluoride.